With me now is journalist and cancer survivor Lynn Faulds Wood, and alongside her is Julia Manning, who's chief executive of the think tank 2020 Health. Lynn, you surprised by this?
I'm not surprised at all, and in one way it's a good news story because so many more people are surviving heart attacks and strokes now that something's got to get you. I mean, people remember maybe on Watchdog 24 years ago I was diagnosed with advanced bowel cancer, and so I know a lot about cancer now.
And the chances of surviving was slim, right? About a third?
For me it was very poor. And here I am. So a lot more people are going to survive going forward, but cancer is very expensive, and so it's going to cost the NHS an awful lot of money. And what we've got to do is what people have been talking about all day, is get people thinking about preventing it. Just modify your life a bit and try to live longer, give up smoking, that kind of thing. But going forward, if we save all these people, 1 in 2 people from cancer, something else has got to get them. So we've got a lot more dementia coming our way.
Yes, I mean, a lot of people are responding to what seems, Julia, like a scary headline. Half of us will get cancer, by saying, well, yes, we've all got to die of something. Perspective is key in this, isn't it?
It is, and actually the research is for those who are born after 1960. So those who are in their 40s, 50s, those are the ones who are being told if you're born after 1960, you've got a 1 in 2 chance of developing cancer because you're more likely to survive into your 80s and 90s. And cancer is primarily a disease of old age. When you get it when you're younger,
right.
No, it's really quite unlucky. But the majority of people develop it when they're older, and the older you get, the more likely you are to develop cancer.
But also, Lynn, I mean, lifestyle, as the report says, makes a big difference here. And it's worth pointing out some cancers are becoming more common. I mean, tumours in the food pipe, for example, caused by acid reflux, and that's down to obesity, they're saying. So, of course, you can see a link with lifestyle.
People know all this. They just don't want to hear that, I'm sorry, if you get fat, or if you drink a lot, or if you smoke, you're more likely to get cancer than somebody slim like yourself, Matt.
Well, we don't know what's on the inside, I'm afraid.
No, but the fact is, we know that. How do you convince the British, though? We're a nation of individualists. You know, I was in Europe for a long time because I helped set up the European Cancer Patient Coalition. And in Europe, they live cleaner than we do. They don't drink as much. You know, the Scandinavians, you tell them what to do, and this is good for you, they'll all do it. The British will say, I'm not doing that.
Not only the lifestyle differences, Julia, but also in how their healthcare systems deal with cancer. We seem to be lacking behind there as well.
Yes, our outcomes aren't as good as the average in Europe. And one of the things that a lot of people have been trying to focus on is early diagnosis and enabling, because the earlier you're diagnosed, the more likely you are to recover from a cancer. Doesn't always happen. You know, if you get a really virulent form, unfortunately, the odds are still against you. But on the whole, the earlier you're diagnosed, the better. So, you know, some people think that we should have more screening for different types of cancer. And screening is sometimes helpful, but we need to remember screening isn't a diagnosis. And you can pick up false positives, and you can miss, false negatives where people actually do have cancer, but they're told, no, you're okay. So we've got to be careful about that.
Prevention is clearly better than cure, but some of the cures are very effective. They're also, Lynn, very expensive.
Well, that's the trouble. You know, my disease, bowel cancer, you shouldn't really, if we do it better, you shouldn't really need all these expensive drugs that people are shouting for. The trouble is the money tends to be in the drugs. And so you get much more emphasis on trying to save people rather than stopping them getting it in the first place. There's not much money in prevention.
The other thing you hear anecdotally is people say, look, I went to my doctor, or I spoke to an oncologist, and they sort of said, oh, you know, it's IBS you've got, or it's something else. Are the cancer professionals taking it seriously enough?
We're not doing it well enough. I think there's a lot of training needs to be done.
Julia?
Well, I think, the cancer professionals, those who've specialised in cancer, absolutely, they take it really seriously. And we've got some fantastic charities based in the UK, who've really promoted research and, progress in treatment.
Can I just interrupt there? That begs the question, though. Are there too many cancer charities? They're all fighting for the same money, aren't there? There's an awful lot.
I think that's a whole different...
It is. It's a different discussion. Yeah.
But in terms of what we need to do in this country, we need to absolutely take prevention more seriously. We need to take steps ourselves so that we live more healthily. And I do actually think we need more awareness about the risk factors such as alcohol and obesity, because actually I don't think a lot of people know that every time you have a drink, your cancer risk goes up.
So they're saying it's 50-50, but it doesn't have to be. Julia, Lynn, thanks very much indeed.
Thank you.